Well, today is World Mental Health Day, and while attending the Florida Behavioral Health Conference in Orlando recently, I sat down with the regional CEO of a mental health rehab treatment center in Sarasota, and I asked why we're seeing so many kids struggle with their mental well-being. She says it all comes down to education and resiliency.
Experiencing trauma is inevitable, and we need to prepare for it.
Melissa Larkin-Skinner is the regional CEO of the Centerstone Mental Health and Addiction Treatment Center. And with more studies showing depression and anxiety levels rising with teens, Melissa believes we cannot make cell phones or tablets solely responsible.
I don't think we can blame it on any one thing. I mean, social media is an easy target, and it certainly contributes, but it's really more about life.
Melissa says children need to be given tools at a young age on how to handle whatever life throws at them.
Trauma happens, right? And I think where we're failing them is we're not preparing them for it.
She adds it's all about teaching kids resiliency.
Problem-solving skills, critical thinking skills, decision-making skills, developing a sense of self-worth and self-esteem. All of those things build. I think of them as building blocks, like I'm building a foundation. And then that foundation is what helps us throughout our lives deal with those traumas.
And if adults or kids struggle with any challenges in life, especially episodes of trauma, we need to talk about it.
We spend a lot of time being afraid of saying the thoughts that are in our head because we're afraid of what other people are going to think of us. So it's important to find a safe person to be able to say it to, someone who's not going to judge you, that'll just listen. Therapists are perfect for that, but many of us have other people in our lives where we can do that.
With the stress felt nationwide due to the political divide, financial worries, or the future of the country, we must remember to be kind.
We have to support each other. Stop judging each other. We should be focused on our similarities, our commonalities, and not on our differences. Acknowledging that we're all human beings. We all experience anger, depression, sadness, anxiety, but also happiness and joy.
And Melissa hopes mental health assistance will be easier to access in the near future.
My dream is that people get the care they need when they need it and who they need it from at the moment they need it.
Meanwhile, we have several links for several mental health resources on our website. Just head to abcactionnews.com/notalone.
All right, thank you, Wendy. Still ahead on ABC Action News.